Australia's booster program won't be fast-tracked for now, remaining at 5 months despite rising COVID cases. It comes with a plea from the Prime Minister to wear a mask indoors ahead of Christmas.
With just 2 days until Christmas, COVID cases reach a record high, above 5,600 for the first time in Australia. The Prime Minister says expect that to keep rising.
With Omicron, what we're dealing with is a much greater volume of cases.
National Cabinet has been briefed on the Omicron outbreak. So far, hospital admissions and ICU numbers are under control.
We have not yet seen any significant impact on our hospital system.
But precautions are being taken. Masks indoors will be recommended, but not mandated nationwide.
What matters is that people wear them, not whether people get fined or not.
That's despite advice from the Chief Medical Officer that a mandate be implemented.
The health advice is wear a mask.
Can you tell the states, though, that they should mandate that in indoor settings?
I've said that mask use should be used.
It seems to me that the government needs to be listening to that advice and acting accordingly.
Ahead of the emergency meeting, some states pushed for the booster jab to be fast-tracked.
We're very hopeful that at the National Cabinet today we'll get agreement to go from a 5-month interval down to a 4-month interval.
That will be a decision for the vaccination experts at ATAGI.
That decision could shift, with ATAGI meeting on Wednesday to look at the evidence again. Leaders are united, though, in the push to get Australians to roll up their sleeves for a third time.
More than 50% of those eligible for boosters have now had them.
The Prime Minister insists supply isn't an issue anymore, instead pushing states to reopen mass vaccination hubs.
There's about a quarter of them which were stood down. They now need to be ramped up again.
No, some will be scaled down and scaled back up. Look, people deserve to have a bit of a break.
The expert medical panel has also been tasked to provide advice on how to prioritise the booster rollout.
You can't vaccinate 20 million people on one day, regardless of when you make the eligibility criteria.
As the Commonwealth restores funding to GPs and pharmacies as a part of the rollout.
And we'll be increasing them up by $10 a jab.
National Cabinet has kicked the can down the road when it comes to mandatory COVID testing for interstate travellers. The Prime Minister has revealed he thinks it's unnecessary, but some premiers are refusing to budge. Queensland, South Australia, Western Australia, Tasmania and the Northern Territory all force visitors from Victoria, the ACT and New South Wales to get a PCR test 72 hours ahead of arrival. Why should Australians who don't have any COVID symptoms have to test at all to go across state lines?
I think that's a very reasonable question. And this is putting unnecessary pressure on the testing system.
The PM says the proof is in the test results.
1 in 1,000 people who are being tested who are travelling are proving to have a positive response. For those who are close contacts, that's 17 to 20.
Leaders aren't due to meet again until the new year. Trudy McIntosh, Sky News, Canberra.